So there you go. So we were talking about if a patient comes to your clinic and they want to get tested for HIV, or they actually test for positive for HIV, it's important to discuss with the woman the reproductive career, that there are still possibilities for them to have their family, to get children that are HIV negative. So it's important that this conversation occurs when you are a provider of reproductive health services and when you get women tested for HIV. So let's look at the situation of the Philippines now. So at least here in Cebu, nandyan pa rin ang drug use problem. And we know that IV drug use is uh, it's a risk factor, no? Or it's a risky behavior that leads to HIV transmission. There's still gender-based violence, and during the COVID pandemic, there was an increase in the prevalence of or in the incidence of gender-based violence. And we know that there is actually a link between gender-based violence and HIV infection. There are also many women who get pregnant in their teenage years and do not actually want to get married, so they remain single and they may be teenage mothers. And there is still a high incidence of new cases of HIV. And unfortunately, there are still late diagnosis or already AIDS-related deaths. And this is what we want to prevent. We want to get that message across that HIV is not the end of the world, but um, that we can still continue to live normal, productive lives that's despite the diagnosis of HIV. Sige, so this session talks about, next slide please, prevention of mother-to-child transmission. Next slide please. So what we're going to do today is to discuss what are the available services that can be provided for sa mga PLHIVs. Sige, next slide please. And to discuss the principles of HIV transmission and management, and to emphasize HIV screening, counseling, and testing during pregnancy and among menstruating girls. We want to be as opportunistic as possible, not just like the HIV virus. We want to be opportunistic and to get as many people at risk as possible tested and knowing their status. And we want to identify what resources are available in the management of HIV/AIDS in pregnancy. If you're looking at research journals, you have to critically appraise these journals. If applicable ba yan in your situation or not. So pwede kasing like for example, when we talk about breastfeeding, in richer countries, they usually opt not to breastfeed because they have formula milk available or replacement feeding available. And infectious diseases like waterborne diseases are not prevalent in their areas. But that might not be the case here. There are areas in the Philippines that do not have access to safe drinking water. So if you look at those conditions, then it means that breastfeeding might be the more viable option, so long as the mother is taking adherently their antiretroviral drugs and the baby is provided with prophylaxis. So these are the things that we will be discussing. And I'd like, next slide please. I'd like to just mention that the things that I'm talking to you about now are taken from this handbook, handbook of the PIDSOG, our society, on a guidance for clinicians on the prevention of mother-to-child transmission of HIV in the Philippines. No? So this is available in PIDSOG if you want to get a copy of it. But most of the things that I talk about will be coming from this reference. Sige, next slide, please. I want to give you a sample case. One of the patients I've had before, itago na lang natin siya sa pangalan ng Annie. No? Annie Batong Bakal. She actually ran away from an abusive home environment at 16 years old, finding shelter at a bar while working as a waitress. So isang grupo sila ng mga magkakaibigan na they actually ran away from abusive homes. After a few months, they realized na wala silang pera, so they had to work at a bar, no, waitress sila. Pero sabi ng bar manager, they can earn more if they would entertain customers, no, kung mag-table sila ng customers. So next slide, please. Looking at this particular case, we see that primary prevention of HIV infection has to start in adolescence, mainly because infections now occur at a younger age. No? On average, the initiation to sex and drug use is between 14 and 19 years old. And this is also why in Reproductive Act 11166, we are actually allowing 15 years old and above to get tested for HIV even without parental consent. Kasi dati nabubuntis sa ang mga babae na hindi sila pwedeng magpa-test ng HIV kasi wala silang consent ng parents. Wala nga silang consent na makipagtalik at mabuntis, di ba? So, kailangan i-allow din natin sila na ma-test para mabigyan natin sila ng interventions to prevent mother-to-child transmission. Because counseling and testing is the gateway to treatment, care, support, and prevention. So we want, if a mother is infected with HIV, we want their unborn child to not get HIV. Okay, sige, next slide please. So when we're talking about prevention of mother-to-child transmission, there is a DOH program as early as 2009, no? This is the Administrative Order number 2009-0016. These are the policies and guidelines on the prevention of mother-to-child transmission of HIV. So this is as early as 2009, meron na pong ganitong programa. So we want to prevent mother-to-child transmission, and there are 4 prongs. Next slide, please. Prong 1 is to prevent primary prevention of HIV among women of childbearing age. Basta't nagre-regla ka na, dapat alam mo kung anong HIV kasi ito ang possible na complications of the sexual act or the marital act. Kung kaya mo mag-sex, kailangan kaya mong tanggapin lahat ng consequences ng pakikipagtalik. That's 1. So how do we do this? We have a lot of interventions to inform the youth, about what HIV is, what are sexually transmitted infections. Not because we assume that they're having sex, but we see based on data that the age of the patients who get HIV are actually increasing among the 15 to 24-year-old population that comprises about 30% of all those who test positive for HIV are within 15 to 24 years old. So our interventions have to start at that age. This is how data can work for us, no? So when we have advocacy campaigns, for example, ang dami throughout the year na pwede nating gawing advocacy campaign. Sa May 5, nandyan yung menstrual hygiene. Sa 3rd Sunday of May, nandyan yung International AIDS Candlelight Memorial. Sa December 1, nandyan ang World AIDS Day. So there's a lot of opportunities all throughout the year for us to conduct advocacy campaigns, especially among the youth. Okay, so ang goal natin, yung mga nagre-regla na, dapat maiwasan natin magkaroon sila ng HIV. Okay. The second is, kung hindi natin maiwasan, if we cannot prevent HIV among those who are of childbearing age, then at least we prevent unintended pregnancies. How? We provide family planning. They get options. We give them, we teach them correct and consistent condom use if they're already sexually active. So it's important that they can plan out their pregnancies, especially if they're HIV positive. We want to promote adherence to antiretroviral drugs because there's already this concept of undetectable equals untransmissible. So by making sure that your viral load is undetectable, you reduce the risk of HIV transmission to a negative partner or discordant couples. The woman is HIV positive, the man is HIV negative. Then with ARV adherence, you reduce the risk of transmission to the HIV negative individual. And we can also introduce already the concept of PrEP, no, pre-exposure prophylaxis. If the if the woman is in a long-term relationship, they can still enjoy a healthy sexual life with correct and consistent condom use, but the HIV negative partner can also start taking antiretroviral drugs, especially at the time that they want to plan out getting pregnant or conceiving. So, hindi naman pwede mabuntis na naka-condom sila. Kailangan may unprotected penetrative sexual intercourse. And that's when we advise them for PrEP. Okay, so that's the second prong. The third prong is kung HIV na yung patient, na pregnant pa siya, we failed to prevent unintended pregnancies. Then we have interventions to prevent vertical transmission, no? Transmission from the infected mother to her unborn child. Yan yung prong number 3. And there are interventions during pregnancy, during labor and delivery, and after or postpartum, when it deals with infant feeding already. So we will be discussing that later. And the fourth prong is providing treatment, care, support to women living with HIV, their children, and their families. Sige, next slide, please. So when we talk about the prong one, is to prevent women of childbearing age from getting infected with HIV. Ano ba yung panlaban natin? Knowledge. We have to inform them of HIV 101. And it's as easy as 1, 2, 3, 4, 5. Di ba? So pag pinag-uusapan natin ng HIV 101, we have key messages that we want to deliver. And one, they have to know what HIV is. It is a virus. It is acquired from another person and it involves humans. So HIV, human to human. HIV is immunocompromised. It reduces the natural defense, the immune system. And then V, it's a virus. Yan yung what is HIV. The second, number 2, is that HIV is different from AIDS. It means that anybody with HIV can have AIDS, but you can actually prevent occurrence of AIDS with adherence to ARVs. No? So magkaiba ang HIV and AIDS. Just because you have HIV doesn't necessarily mean that you need to have AIDS. Okay? Pero lahat ng may AIDS, may HIV. So it's a spectrum. It's stages of the HIV infection. You can always stay at the asymptomatic stage of HIV infection. They can look like you and me, no? Healthy, living productive lives as long as they remain adherent with ARV. So may forever sa HIV, no? Yan yung tinatawag nating antiretroviral drugs. So we have to remain adherent. Ang 3, itong nandito sa slides. Number 3 is the modes of transmission of HIV. It's through unprotected penetrative sexual intercourse with an infected individual. The second is transfusion of infected blood through sharing of needles during injection drug use. And number 3 is from an infected mother to her unborn child. So ito lang po yung tatlong pamamaraan na pwede kang magkaroon ng HIV or mahawa sa HIV. So just by hugging, you're kissing, and eating together, or using the same toilet, or using the same eating utensils, or swimming in the pool with an HIV-infected person, you cannot get HIV. Now, these are the only 3 ways that you can get HIV. So we have to let our adolescents know about this so that they can actually prevent it and not fear HIV, but protect themselves from getting infected with HIV. And the 4, di ba, 1, 2, 3, 4, 5. Nandun tayo sa number 4. Yan yung body fluids that have high concentrations of HIV. Number 1 is blood. Number 2 is vaginal fluid. Number 3 is seminal fluid. And then number 4 is your breast milk. So yan lang yung 4 body fluids that have high concentrations of HIV, high enough to infect or to transmit HIV. And the next slide, please. Then yung number 5 natin will be about the methods of HIV prevention. It's as easy as A, B, C, D, E. Minsan medyo corny pag-usapan, pero importante pag-usapan natin sa mga kabataan. A, abstinence. You wait for your one true love. No? So wag makipagtalik unless you are already ready. When you found your one true love, that's when you give your virginity. So abstinence. Yan lagi ang first. Ang B, pag meron ka ng partner, meron ka ng one true love, you have to be faithful. And you have to be mutually faithful. Hindi pwedeng si lalaki lang ang faithful, si babae faithful sa lahat ng partners niya. Hindi din pwedeng vice versa. It should be a monogamous relationship. You have to be mutually faithful. And then C, when you're talking to adolescents, C should still be check your status and get tested. If you test positive, then we introduce the concept of correct and consistent condom use. And D is don't do drugs, don't drink alcohol, and don't even start smoking because once you pop, you can't stop. It's a habit that's difficult to break. So don't even start it. And then E is educate yourself and others. What we're doing now, it's easy to talk about this when you get the hang of it. Talk about it like it's commonplace, like it's something that you can talk about over coffee or tea or during snacks or during parties. No, we've seen in social media how they can just simply talk about HIV and what it is not, and how to prevent it and how to identify individuals with high risk behaviors. Yan. Can you still hear me? Hello?
Yes,
Yan, sige. I have to ask pala, no, I keep breaking into Tagalog eh. Our audience Tagalog speaking or Bisaya?
mixed doc. Luzon,
A
Visayas,
mix.
Mindanao.
Okay. Sige. Pero sana naiintindihan niyo ako pag nagtatagalog ako minsan, no? So, I will try to stick to English from now on. Sige. So, dun tapos na tayo sa ABCDE, no? That's what 1 2 3 4 5. So, ang dali lang pag-usapan ng HIV 101. Next slide, please. So, if you can see, no, you can actually talk about HIV in schools, under the mango tree, no, in the community, in the barangay hall. You can talk about HIV amongst the youth in different venues, no. So even they can actually talk about HIV. And if we can link with teachers, no, kasi if you want the children to know, to understand what HIV is, you teach the teachers so that you can multiply yourself. Yes? Okay lang? Okay, sige. I will continue. So, next slide. Let's go back to Annie. What happened to Annie? If you remember, she ran away from home and she went to a bar, and then they encouraged her to entertain customers. But there came a time when she had drug use and they were sharing needles kasi 20 pesos yung isang needle and they had to share it kasi wala silang pambili. Next slide, please. So there were unprotected sexual intercourse with multiple partners. But there was an NGO that actually rescued them from the bar because they are minors and they were working at the bar entertaining customers. This was considered as human trafficking. So they were rescued from the bar by an NGO. There were policemen and there were social workers. And all of these adolescents were tested for HIV. Unfortunately, Annie tested positive. Sige, next slide, please. So it's just like the situation of Annie, that they were rescued, no? We have to have adolescent health programs addressing adverse childhood experiences. And this could have helped prevent child sex trafficking. When you're talking about adverse childhood experiences, there are potentially traumatic events that occur in childhood from 0 to 17 years old. For example, those experiencing violence, abuse, or neglect, and witnessing violence in the home or community. So it's important that in your clinics, you have adolescent health programs and you have programs on gender-based violence so that we can prevent this. And we can partner with the DSWD and we can partner with the PNP. So we don't have to do everything ourselves, but we do have linkages and networking with people who can actually do something about this. So that's part of the primary prevention of HIV among childbearing age. So next slide, please. So prong two is for those women with HIV, we want to prevent unintended pregnancies through effective and acceptable forms of family planning. And next slide please, we introduce this concept of dual protection. What is dual protection? We recommend long-acting contraceptives like your IUD or your subdermal implant to prevent unintended pregnancy. So even if the PLHIV is taking ARVs, there's no interaction, no, or contraindication, or there is no drug interaction with IUDs or subdermal implants. But at the same time, when you have long-acting contraceptives to prevent unintended pregnancies, you still recommend for every sexual intercourse, no, use correct and consistent use of condoms to protect them and their partners from HIV transmission. So that's dual protection. Meron ka ng long-acting contraceptive but you still encourage correct and consistent condom use. Next slide, please. And for contraception, the best protection can be obtained by using or choosing sexual activities that do not allow any of the four fluids with high concentrations of HIV to enter the vagina, or blood to enter the mouth or vagina or anus of the partner. Okay. And correct and consistent use of condoms during every sexual act. And babalik tayo sa A and B, abstinence and be faithful, you reduce the number of your partners. Ayan. So next, let's talk about Annie again. She was offered different forms of contraception and opted for the subdermal implant and correct and consistent condom use. Since she was dating and she was sexually active. She hopes that he is the one and that she can tell her partner one day about her HIV status. So, as healthcare providers, it is important that we know how to empower our patients to disclose their diagnosis to their loved ones. No, we cannot force them, but we can empower them and give them the courage to disclose and trust that their loved ones love them enough, no, to accept them, pimples, warts, and all, and HIV status included. Next slide, please. So for prong three, for the pregnant woman living with HIV, we have to prevent mother-to-child transmission of HIV infection. The first is ARV initiation during pregnancy because we want the viral load to be undetectable so that it will also be untransmissible. And the second is safe labor and delivery techniques. And then the third would be safer infant feeding. Next slide, please. So I got this from the POG's handbook, no? It talks about HIV screening, antiretroviral drugs, management of delivery, infant feeding, and contraception. And also from the handbook of PIDSOG, next slide. And this includes, in addition, no, early infant diagnosis and final diagnosis for HIV-exposed infants through linkage of both mother and child to appropriate care and treatment. Okay, next slide. So luckily, Annie, her relationship with her partner lasted for more than a year, and they wanted to discuss about pregnancy, and then they had the subdermal implant removed, and so that they could get pregnant. So viral load determination was done, and with ARV adherence, her viral load was undetectable. Next slide. So we now talk about HIV screening because providers of obstetric care should inform the patient that an HIV screening test will be performed as part of the recommended routine antenatal package of tests of infections, including sa hepatitis B, syphilis, RPR, VDRL for syphilis, rubella IgG if this is available. Pap smear will detect your HPV or human papilloma virus, and a urine culture will detect UTI. Okay, next. And this is how you should deliver the preliminary counseling dialogue or the key message. I'm getting you tested not because I think you are promiscuous or that you look promiscuous, but the fact that you are pregnant is an evidence of unprotected penetrative sexual intercourse, which is a mode of transmission of HIV. So if this is how you state your key message, there is no judgment. No, I'm offering you HIV testing because pregnancy is evidence of unprotected penetrative sexual intercourse, which is a mode of transmission for HIV. Next slide, please. And with HIV screening, it's part of the assessment in relation to pregnancy, and it should be a routine interview with standard counseling about HIV. You have to encourage them and reassure them that the results will be completely confidential. But if they still do not want to get tested, then they may opt out of getting tested. But you don't stop there. You discuss about HIV counseling and testing again at a later date. Babalik man yan for your prenatal. So you try to convince them again to get tested. Okay? Next slide, please. So the recommended is start triple ARVs as soon as diagnosed. This is the concept of test and treat. We test all, we treat all. Yun. So we test all, and we treat all. And for pregnant patients, we have to make sure that we test them before 4 weeks before delivery so that we can initiate ARVs, so that we can reduce the viral load safely and prevent mother-to-child transmission. Next slide, please. The impact of the test and treat. Number one, for the program, no, for women living with HIV, it simplifies requirements. No, we don't need to wait for the CD4. We don't need to wait for the viral load. As long as they are tested positive and they have no OIs, no obvious OIs, then you start, and the patient is asymptomatic, you start them on ARV. The impact for the unborn child, it is an extended protection against mother-to-child transmission. And for the HIV negative partners, it is prevention against sexual transmission among serodiscordant couples. Okay, next. And the message basically is once ARV started, it is taken for life, forever. Yan. Okay, next. So when the patient is pregnant, we have to plan out when to deliver. The first line would be an elective cesarean delivery scheduled at 38 weeks age of gestation. And emergency cesarean is done for those in labor and with ruptured membranes less than 4 hours unless delivery is imminent. However, next slide, we do allow vaginal delivery if the patient wants to undergo vaginal delivery. For those who have ARV treatment, are if they are adherent to ARV treatment for at least 4 weeks before delivery, and the viral load is less than 1,000 copies. But nowadays, we want it to be undetectable. But if the membranes are ruptured, the time elapsed should be less than 4 hours to delivery. And next slide, we still recommend essential intrapartum newborn care, except that we do not do delayed clamping of the umbilical cord, and latching is done only if breastfeeding has been chosen. Sige, next slide, please. As far as infant feeding is concerned, primarily it has to be based on informed consent because we do not recommend mixed feeding. The mother has to choose whether she will exclusively breastfeed or she will exclusively AFAS replacement feeding. And AFAS is, next slide please, replacement feeding, which is acceptable, feasible, affordable, sustainable, and safe. And breastfeeding is still best. So if your clinic can come up with a milk bank with HIV negative donors, then that would still be breast milk, no? Next slide, please. So these are some of the summary or of statements of our society as far as mother-to-child transmission of HIV is concerned. Sige, next slide. Prong 4 is about providing treatment, care, and support to women living with HIV, their children, and their families. Next slide. So we also want to talk about prevention of HIV infection among healthcare workers. Enough na po ang standard precaution, and there is available post-exposure prophylaxis to those who have needle stick injuries. But you won't get needle stick injuries if you're careful and have standard precautions. So we follow hospital infection control. So we don't need to be afraid of our HIV patients kasi nga, if we go back to the mode of transmission, it's difficult to get HIV, no? Next slide. So this is the spectrum of services that you can provide for treatment, care, and support to women living with HIV. So you provide them with immunization, recommendation and advice for healthy lifestyle that includes diet, exercise, adequate sleep, prevent or reduce stress, no? And also STI and cancer screening, opportunistic infections, provide support groups. It's difficult to have HIV. It's also difficult to be a mother to an HIV exposed newborn, especially if the woman is experiencing gender-based violence. Okay, you have to provide support groups. And for those who need to separate from their partners from an abusive relationship, we have to provide livelihood skills training so that they can stand on their own, and also advocacy to reduce stigma and discrimination. Early on in 2015, we noted that the stigma and discrimination is actually coming from the healthcare workers. But with consistent advocacy campaigns, we have reduced stigma because they already know, they're more aware about HIV these days, and it's more acceptable to get tested for HIV. Next slide, please. So we have the framework of the WHO recommendations and good practice statements to advance the sexual and reproductive health rights of women living with HIV. Okay, and we next slide. You see that the center of the wheel is the woman living with HIV. It's a woman-centered approach, and it promotes gender equality and human rights. So it's a rights-based sexual and reproductive health program. Sige, next slide, please. So what does this include? You have to provide services against violence against women. Next slide, please. You also provide family planning services. Next slide, please. You also provide antenatal care for PLHIVs. Next slide. You also provide safe abortion services. Now, we were talking about this yesterday with Ma'am Joy. It doesn't mean na you provide therapeutic abortion, because this is against the law. No, the Philippine Constitution does not allow abortion because it's murder. So what this means, safe abortion services, is for those women with miscarriage, meaning spontaneous abortion. You have to provide services that will ensure her safety and that she survives the spontaneous abortion. Okay, next slide, please. You should also have sexually transmitted infection services, no? Because HIV is a sexually transmitted infection. You also provide for services against other sexually transmitted infections. Next slide. That includes your sexual health counseling. So you minimize the number of sexual partners. You provide a family planning. You advise correct and consistent condom use to prevent sexually transmitted infections. Okay, next slide, please. So the health interventions that were mentioned, these should be included in your menu of services in your clinic. Next slide. And of course, this is one way of providing information to the general public. No, in our clinic, in our hack, no, we have the Kaambag webinars. Kaambag is the name of our clinic because we are partners. We want to make sure that the patients know that they are partners, that they also have to deliver their part. So every Thursday night, 7 p.m., we have these Kaambag webinars. We just simply talk about things that may be relevant to our patients. Okay, next slide, please. I will end this lecture no with this slide. Naging friend ko itong PLHIV. No, this guy got HIV from his parents. No, he was born with HIV. But he said that HIV stigma and HIV infection will end with me. He found his one true love, HIV negative, and they had three beautiful children who are all HIV negative. So his message was that having a negative family can be the most positive thing in your life. Yan. So sana dala-dala natin yung image na yan, that PLHIVs can still have their own, build their own families without having to pass the HIV infection to their loved ones. Yan.